Hello, everyone. My name is Simiran Choudhary, and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025 as we celebrate the strength, resilience, and remarkable contribution of women across the globe. It is equally important to shed light on critical health challenges faced by women, one of them being cancer. So this session aims to emphasize on the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today, we are truly honored to have with us Dr. Tejinder Kataria, Chairperson of Radiation Oncology at Medanta Cancer Institute, Gurgaon, a distinguished leader and a pioneer in the field of radiation oncology, with an illustrious career spanning decades. Dr. Kataria has been at the forefront of advancing cancer treatment, driving clinical excellence, patient centric care, and groundbreaking innovation in radiation therapy. Her invaluable contributions have not only saved countless lives, but have also redefined standards of cancer care, inspiring hope and healing for patients across the nation. Welcome to our platform, ma'am. It's a pleasure to have you with us.
Good afternoon, Ms. Simiran Choudhary and the listeners who have keyed in today. Thank you for having me, Voice of Healthcare, and Kedla. Thank you for sponsoring this event. You rightly said that this is the time that the women take a choice to look after themselves and look after their health. So I think we are here to assist them in making the right choices, going for screening, fighting, and winning this battle over cancer.
Thank you so much, ma'am. So, in today's session, we will discuss early detection, breaking screening barriers, and advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage regular checkups, and reduce the fear of cancer. So, without any delay, we would like to start the conversation. Ma'am, my first question to you is this: why is this early detection so critical in improving cancer survival rates? And can you share any real life example or case study you have come across which have made this early diagnosis a significant difference?
So, cancer is a disease which mimics many other diseases. So, patient does not get to know that they have a cancer till it is very advanced and they start getting symptoms. Hence, screening is very important for certain cancers like breast cancer, cervical cancer, lung cancer, where we can pick up this cancer when the patient doesn't have symptoms. And there are guidelines which have developed over the last 3 or 4 decades where the refinements have happened that without causing much discomfort to the patient, you can pick up a cancer early that can be cured. And that is why screening is very important. A case in point is cervical cancer screening, which started way back in late 80s in Europe, and the early cancers were picked up in stage 1 and 2, and the cure rates there are to the tune of almost 90%. And the late stages 3 and 4, your care rates fall down to less than 50%. So cervical cancer screening for a woman who's sexually active after 10 years of marriage or after first sexual contact is recommended for them to have a pap smear and have an HPV testing. Now, vaccine has also come. We are not talking about that, but the women who've not had, or even if they've had the HPV vaccine, should go in for the screening for cervical cancer. And it has saved over 160,000 lives from the time that the pap smears were, applied to the clinic. So that's a big, big saving on the human life and the suffering. Similarly, for mammography, which is a small X-ray test that can be done for women between the starting at the age of 40 to 44, and early in case there is a family history of breast cancer, which saves 2 lives per thousand screens done. So these are the kind of things which can empower a woman to take her health in her own hands and detect an enemy which is growing in your body, but you don't know about it. So that's where screening comes in handy, and women need to be empowered to go and ask for screening from their gynecologist and from their physicians.
You said it right, ma'am. We need to be aware about what is growing inside our body. It could be cancer, it could be anything other thing. But with the help of screening, diagnosis, and the advanced technology, it has become easier that these things can reduce with the reduction of time. We can diagnose it in a better way at a very early stage. But still, the awareness is very low, and like you said, we need to empower more women for they go for the regular screening. We need to educate them. But with that also, what do you think is the biggest barrier preventing women from undergoing regular screenings like mammograms, pap smear, or genetic testing, which is available? And how can we break these barriers, especially in the rural areas or underserved communities, where I believe this awareness or education is little less as compared to the urban areas.
So, the biggest barrier in preventing a woman from undergoing regular screening is the fear that if a cancer is detected, then what will happen, right? And there is a stigma. Even today, people take diagnosis of cancer as a stigma. They do not want to be labeled because it brings in sometimes loss of job, financial worries, and emotional worries, plus the family concerns. So, those are the things for which a woman needs to be informed, that awareness has to spread, that it's a health, and there are services available, especially with the government aids, and also there are empaneled organizations who take up the care of these patients. So, like, there is a central government health scheme. There are, for army officers, there is a program where these tests can be done, and they can be treated in case a cancer is detected. And the other barrier is that people think that if they go in for cancer screening and cancer is detected, they do a biopsy, then the cancer will spread. And the third thing is they think cancer is communicable. That if they have a cancer, then it will spread to the other family members. So, there are so many things which are going on in their minds, and it's not easy to get across to them and let them know that cancer, one, it is non communicable. If a biopsy is done, it does not spread. If a screening is done, it may be picked up in a few percentage of cases. Maybe 1 in 10 screened cases may be having a small cancer, which, if picked up early, can be cured with maybe one modality of treatment. A patient may need just surgery, and if it's a good risk cancer for breast cancer, they may need to be on a pill for maybe 5 years. They do not need to undergo chemotherapy. Then there is fear of loss of hair, alteration in body image because they see their friends or family members undergoing treatment. So there are so many things which are going around in their mind when they look at cancer and cancer screening. So I think that fear needs to be taken out of a person's mind, and also give them this awareness that cancer does not mean a death sentence. Cancer does not mean that it's not going to get cured. Having an early cancer means that it can be cured and you can have a very fulfilling, normal life after the treatment. So I think once this message goes out, many women would come forward to have this screening done.
Very true, ma'am. People believe that once a cancer is diagnosed, it's a death sentence. But as you mentioned, if early diagnosed, it is treatable. It is curable. You can live your life like the way you were living earlier. So I think that awareness and that the fear which is there in the head, if biopsy is done, if it is being diagnosed, and all such things which is there in head needs to be cleared out, that nothing will happen. And for that we need more and more such kind of awareness sessions, one-on-one interactions with the people of villages and everyone, where we can educate and aware them. But since we're
So
talking
for
about this.
the villages, I would say that we need to work as organizations who are doing the tertiary care for cancer to work with the ASHA workers, with the primary health centers, create the awareness modules, tell them how to do the screening for the pap smear as well as for the breast, breast self examination, which an ASHA worker or a primary healthcare worker can provide to a woman, and then regular periodic screening via mammography can be done in the district hospital. So we need to create a chain of awareness right from the tertiary hospital down to the village level to be able to get the screening program, spread far and wide till the rural villages are there.
Very, very rightly said, ma'am. And we need to focus on that also. And as we just discussed about the fear which is there in the head, if what if it diagnosed and it may cause this and that. So there's so much of myths and misinformation around. So how can healthcare professionals encourage public for routine checkups without causing this unnecessary anxiety amongst them?
So I think the first thing is for the healthcare workers also to have the information and provide it with confidence to the patients that once you get the screening done, there is a treatment available. It's not a shot in the dark, right? And there is a proper protocol which is laid out in case the cancer is picked up early, that they would follow that protocol and they would get the treatment and be cured of it. So that is the first step, right? And then thereof, we also have to encourage these kind of awareness camps across to at the schools, at the school level, at the college level, where the women have curiosity about themselves, where they can go back and talk to their family members. If a child learns something, like when we started off with the ban the these firecrackers, the program started from schools. The children would come back and tell you that the crackers are going to cause pollution. So we don't want to have the firecrackers around Diwali. And it's been over 20 years. And now we have come to a point where even the adults are coming around and saying, okay, we do not want to have the firecrackers. Right? So it takes time. So something like that, I think we need to focus upon and inculcate at a very younger level in children that screening, looking after your own bodies is something which they should look forward to, and also go back and ask their elders in the house to look after their health and what are the programs available. The school health program, the college health, and awareness should start from there. I think that's where the right way is, to have these young persons mold into a way that they are aware what is available and what can be done to keep the cancer at bay.
Ma'am, like we just discussed about that, it should start from the school level, and then more and more such awareness programs should be there. So we know that cancer does not have any age. It can happen to anyone, any age, irrespective of the gender or any other thing. So just want to understand that are school children safe for getting them this kind of diagnosis and everything? Does cancer start at that early age, or something like that?
No, cancer does not start. We are talking of screening, Simran, and we are talking about screening of cancer. So
Yes.
let's not target the youngest most children, but if the children are adolescents, a breast self-examination, and once we are teaching them about the sexual health, when they're going to go into mature lives, talking about HPV vaccine for preventing cervical cancer, and once they become sexually active, to go in for a pap smear and HPV testing for the cancer service screening, are something which can get started in the adolescent age, class 11, class 12. So that's what I'm talking about. I'm not talking about all other cancers. We are talking about the screening, right? Let's be
Screen.
very clear. And that is the time when even, adolescent age is the one when, because under peer pressure, you start smoking, right? Cigarette smoking is one of the most important and the leading cause of lung cancer. Lung cancer does not happen in young persons. It does not happen at the age of 20. It happens at the age of 50, 60, 70. But there's a latent period. We cut the trees 50 years ago and we are running into a very high degree of temperatures, melting of the snow peaks, glaciers going away. That's not happened today. It started 200 years ago with the industrial revolution 300 years ago, and today we are getting the effects. So similarly, cancer which are preventable cancers, like the cervical cancer, like the lung cancer, you have a question down the line that how can you prevent. So these are the prevention modalities, and we start talking with prevention along with that screening, right? So that's
Yeah.
what I'm talking about. I don't mean that we address a 10-year-old and put the fear of cancer in their mind. I'm talking of grown up girls who are going to get into womanhood, step into maturity, go along with their lives. So that's what I'm talking about.
Thank you so much, ma'am, for clearing that, because you said it right. We need to get that awareness at that early stage, the adolescence age, where they are learning to pick up new things, new habits. about the peer pressures and everything. So I think if and teaching them what exactly about all everything about the safe sex, because they do not do all those kind of mistakes which can create a complication in their health.
Yeah.
Like we are talking about the screening and prevention, so we believe that family history does play a role in it. So how does the family history play in determining a woman's cancer risk, and how can genetic testing help with this proactive healthcare?
So, Simon, you have to understand that all cancers are a mutation or a change in the genetic code of a tissue, right? Because that is at the level of the DNA where the genes are, that the changes or the mutations occur, which lead to a cancer formation. But all the cancers are not inherited, right? It does not mean that all cancers will be inherited by the children if the parents have a cancer, right? That is what I mean. So all cancers are not inherited. Only 5 to 10% of cancers are hereditary. That is, they passed from a parent to a child or from a grandparent to a grandchild. And amongst them is the breast cancer and ovarian cancer and colorectal cancer, right? So the women who have early breast cancer, or where there are both breasts are involved, or there is a male breast cancer in the family, or if there is more than one person in a family, like two sisters, or a mother and a daughter, or a grandmother and a daughter and a daughter, a grandchild. So those kind of things are the ones that happen very rarely, and that is where you need to do the genetic testing. Similarly, for a colorectal cancer, if a person has a colorectal cancer at less than 50 years of age, then we would say that it may be inherited. And there is a condition known as polyp formation within the colon, which can be picked up by screening by doing an endoscopic examination, which we normally recommend for people over the age of 50 years. Like for breast cancer, we say 40 years. For cervical cancer screening, we say 10 years after being sexually active. Similarly, for colorectal cancer, we say that people above the age of 50 should get lower endoscopy done, lower GI endoscopy done every 2 years. But for people where the family history is there, we say you should start it before 50 years or 5 years before the index case. So those are the cancers which are inherited, and ovarian cancer. So that is where we would also advise going in for genetic testing. And a very famous case of Angelina Jolie with the BRCA1, BRCA2 mutation in her mother, and then herself going in for risk reduction surgeries, has been there in the media for a very long time. So those are the kind of cases where we would advise do a genetic testing, but not for everybody. Genetic testing should not be done across the board because it has its own downside, which we can discuss as we go along. But where there is a high risk of developing either an ovarian, breast, or colorectal cancer, or kidney cancers and thyroid cancers, these are few of the cancers which cluster around in certain families. So, based upon the risk in the family, and after discussion with the genetic counselor, who will create a map or a family tree of the person, we would recommend going in for the genetic testing.
Thank you so much, ma'am, for putting light on the genetic testing as well. As the Angelina Jolie example is, quite common, or everyone knows about it, and that's why all these questions were coming in their head. Like, how are they got to know about this with the because of the genetic testing and the advancements and everything. But with that advancements and the new technologies, we have many other options, or better treatment plans for treating cancer. So what, according to you, are some of the most promising breakthrough in breast cancer, cervical cancer, or ovarian cancer treatment today we have?
So you rightly said that medicine has progressed by leaps and bounds, especially in the last 50 years, and then after the molecular biology came in and the computational algorithms increased with the artificial intelligence, we can diagnose the diseases early, and we can also create drug combinations which can help us cure these patients. So for the breast cancer, one is of course the genetic testing that came in, and then the targeted drugs which have come in, right? For patients who have genetic mutations or patients who have receptor positive, where we can do that if a patient undergoes a breast surgery or breast conservation surgery, and one of her nodes is positive. After the surgery, the tumor is just 2 centimeters or 1 centimeter, and one micrometastatic node is present in the axilla. And we do their testing with a certain tests which are genetic tests called as either oncotype, kinesis, or digistate. There are different tests which can be done on that tissue, which tells us the risk of the disease coming back, right? And if the patient has estrogen progesterone receptors positive, then they do not need to undergo chemotherapy. If they are good risk tumors, then they can just be managed with a pill, with an estrogen receptor modulator. So that is the kind of change which has happened. So everybody does not need very extensive treatments, right? And for lung cancer, there is a targeted drug. So the mutations are tested by doing a liquid biopsy. Liquid biopsy is that you take a sample from the blood. And for an ovarian cancer, you can do a liquid biopsy. For breast cancer, if you don't have a tissue, you can do a liquid biopsy. So with the liquid biopsy is that you do a blood sample and you can pick up what are the mutations, what are the cells that are being expressed in the blood, and then you can target them. So those are the kind of advancements which have happened. And this is where we are headed. So we try to now do precision medicine so that you don't give them the either the drugs or the treatment which causes many side effects. So
Yeah.
you will precisely target the tumor and its receptors so that you only kill the tumor cells and don't affect the rest of the body functions of the patient. So this is where we are heading, and this is where the advancements have happened in the last 15, 20 years.
Definitely right, ma'am. Because of all the research, clinical trials, and the advancements, we have come a long way in, having all these better treatment, better options we can without affecting the complete body rather than just targeting the affected area or the cancer cells. So, like we just discussed about the genetic testing and the precision medicine. So, how do genetic testing and personalized medicine help, tailor treatment to individual patients? And are these options accessible to average patient in India? And also, like you mentioned in your previous answer, it just came into my head that is this for everyone out there? Is does genetic testing is required for every person who's been diagnosed with cancer or any other person?
So, the answer to you is that your question is that yes, these tests are available to every person, right? Whoever is coming in with a diagnosis of cancer. But whether every person will need these kind of next gen sequencing or genetics testing, the answer is no. Because we have to be very specific as to what is the treatment that is required for a patient at what stage of disease and what type of cancer. So if a person has an early breast cancer or has an early cervical cancer or has early lung cancer, then a particular treatment is, recommended. If there is a relapse or if there is an advanced disease or if we are able to pick up a target, then we would go in for the genetic testing, because otherwise if we go in for next gen sequencing on the tumor, right? We are talking of now targeted and precision therapy based on the tumor biopsy, not on the genetic testing of the hereditary cancer. So these are two different things. Genetic testing is one is for the person to know what cancers they'll inherit, right? And genetic testing for the tumor is for targeted precision medicine. So that is called as next gen sequencing, whereas we read the map of what types of mutations of genes are occurring in that tumor. Basis that a targeted drug is given to a patient.
Hmm.
So these are available to all patients, but would be decided basis the stage of the disease, basis the type of the tumor, and the stage of the disease. So based upon that, a doctor would prescribe, an oncologist would prescribe that you go on for the genetic testing or the next gen sequencing, genetic map of the tumor, and then go in for a targeted drug or a targeted treatment. Okay? So they're two different things, right?
Yeah. Thank you so much for shedding light on that, ma'am, because it is a very important topic and not much of information is available out there or understanding is there. So thank you so much for explaining. Ma'am, we know that cancer patient once diagnosed goes through so many other things. The treatment option is other thing, other is the emotional and emotional traumas in the family and the patient, everyone goes through it. So how important is counseling and emotional support in treatment, and do we need to integrate more psychological care into oncology for this?
You are right, because like we discussed a little bit earlier, that people perceive cancer as a death sentence,
Yeah.
right? And it happens at an age mostly when they are, working their lives through, because it's most of the cancers which occur by and large are an aging process also, right? In 50s and 60s. So they're settling down, preparing for their retirement, getting their kids settled, and that's when it hits, right? And then it comes to a point where you have a certain life savings planned out, and a certain way of living lifestyle that you are tuned to, and suddenly everything goes for a toss. So there is financial worry, there is emotional worry, there is physical, discomfort because you have to come to the hospital, have the test done, be subjected and seen by the strangers in different situations when you're undergoing surgery or treatment in the hospitals. So it's a lot of conflict and discomfort, which is total discomfort, including all these different factors. So a patient with cancer diagnosis needs not only the family support and the friend support, but also from the medical care. We need and we do have the psychological counselors. And if somebody is depressed or is anxious, then we put them across to a psychiatrist and then have them, be on medicines also. And so this is an integral part of cancer care, that the counseling has to be available to a patient and also to the family and the caregivers, because they also start feeling depleted. They also have to bear the brunt of the patient's discomfort and coming to the hospitals, facing long queues at times and waiting times. So it's not just the patient, also the family's hand holding has to be done, and it should be integrated within the treatment.
Very true, ma'am. Family's hand holding is very much required. The support the family gives with their presence and supporting in every other aspect, because it kinds of the cancer is I believe is kind of which does not only put the patient into strain, it puts the entire family there. And we know how much our healthcare workers are working day and night to give that support, to put all those efforts to save the life and to support the family members as well. So
And I'd
thank you.
also like to bring out, Simran, that we have certain non-governmental organizations, NGOs, which have been founded and are running in the country by the cancer survivors, right? As cancer support groups. And we do, kind of reach out to them when we find that the patient needs hand holding and also needs to talk to someone outside of the medical care workers and who can emotionally relate to their concerns and their situation. So we are very grateful to our these NGOs and the cancer support groups, which support us and also our patients and their families
Very
by
true, ma'am.
counseling as well as monetary help also at times.
We have come across few of the examples like that, how patient support groups helped in terms of emotional and financial support, which you just mentioned. And because of all those facilities, all those supports we have, it has become a little easier. So and credit goes to our community, our society, those who are working day and night tirelessly to support each other.
Yeah.
Ma'am, lastly, as we are moving forward to our discussion, end of our discussion, what advice would you give to women today to take charge of their cancer risk and overall health, as it's an ongoing series to aware women on International Women's Day?
So, there's one piece of advice which I would leave to women, is that they need to raise themselves to the occasion of visiting their family physician or the gynecologist, ask for a proper health check and age appropriate screening tests, so that they do not miss out on a chance of getting a detection of cancer, which is in a treatable and a curable state. So that's what my message would be for the women and all my friends out there for the International Women's Day.
Thank you so much, ma'am. Your words matter a lot. We are actually working together to educate, to aware our public, to make them, inspire that they should take care of their health, and why it is important for, especially for women, to take care of their health extra special. Because with them, the family is together. They are the, I think, the holding person of the family. And thank
Yes,
you
we
so much.
say, you're welcome. We say that if you educate a woman, you educate a family. So,
Yeah.
similarly, if you look after the health of a person who's a woman, then you look after the health of the family and their of the community. Thank you so much, Simran. I really enjoyed talking to you. And thank you to our listeners and the people who keyed in today. Bye bye.
Thank you so much, ma'am. It's a pleasure to have you with us.
Thank you. Bye bye.
Thank you.